Hi, everybody. Real pleasure to be here today with the one and only Dr. Matthew Johnson and the wonderful Joel Stanley. Pleasure to see both of you here today, guys.
Thank you, David.
Pleasure to be with you.
Yeah, so we've got an interesting subject to try and talk about in a pretty short amount of time. Really, that comes down to botanicals and synthetic psychedelic compounds and where they may go with their clinical indications and kind of efficacy in the future. So I think a good place to start, Matt, if you could say, how would you describe to someone who's not a scientist, what's the difference between synthetic versus botanical?
Well, botanical is going to refer to, in this case, that may achieve medical approval that doesn't just consist of a single molecular entity, a white powder of one molecule. And most of our medications are that. You get an aspirin, it's a lump of, before it's made into a pill, it's a lump of white powder that's salicylic acid, one compound. So that's what we think of with medicine. And there's a simplicity there. And if something's the problem, the compound that's the culprit, for example, that's part of that simplicity. And it's what the FDA has the most, has the longest tradition. More importantly, I think it's what society is sort of used to. But certainly, I guess from a much broader perspective, actually, I'll correct what I just said. From a much broader perspective in the history of humanity, it's certainly botanical medicines that have more of the tradition. So plants and other living organisms that have medically active. In this case, we're talking about the psychedelics, so psychoactive and in that case, medically active compounds. It usually consists. There's one compound in there. There's always an exception to the rule, but there's typically a family of related compounds that are sort of this sort of cascade of compounds. Some of which are related to each other, some of which are in different classes, and in some cases, it's been observed in living organisms like plants that there are multiple compounds that interact with each other in a favorable way. Probably most folks are familiar with the potential for CBD to take the anxiety edge off of THC within the cannabis plant. That's just one example. And thankfully, there are now specific pathways for developing botanical medicines that utilize that full spectrum, or at least not this sort of limited one synthesized compound aspect of a plant, but to have both the safety and the standardization that is required for an improved medicine, sort of balanced with the sort of meeting the plant where it's at in its natural state. So those are just my first kind of big picture thoughts. It's all an empirical question. We need to, I'm not for like one versus the other. I'm for all of the above when we apply the right research and we see that it's safe and efficacious. And there's a whole lot of potential of exploring botanicals in addition to isolated compounds.
Thanks, Matt. And Joel, for you, what are some of your thoughts around that potentiality, particularly for botanicals?
Yeah, I think our world this last 100 years, Matt mentioned acetylsalicylic acid or aspirin. I believe that was the first drug we had synthesized. It's like in 1890. So we're going back over 100 years. That foundation of a medicine system, pharmaceutical system, in which we've really built all of our infrastructure and done all of our clinical research on single compounds, single molecules. We either isolate them or we synthesize them. And as we built a system to do that, we've kind of adopted this philosophy that it's easier to understand one molecule at a time. What is it doing in the body? Which is very true. And so we kind of leaned in a way with medicine and science and with the FDA that basically said, if we have too many molecules, it's not good science because we're not advanced enough to understand what maybe 20 molecules or certainly 400 molecules are doing in different combinations. So we kind of locked out these ancient medicines in this kind of, what I call this millions of year old laboratory of nature that over time evolved certain things to have certain phytochemical fingerprints, multiple molecule fingerprints that operate in different ways. And so we haven't until recently been willing to observe the clinical outcomes. What's the efficacy of this? But, now Matt Matt mentioned that we do have some regulatory pathways to start to allow for botanical medicine. And I would say, because we really want to know what these molecules are doing in the body, what are the dynamics within the body, we're just now at a point where we can start to characterize and understand and standardize and work with natural botanics in a way that is acceptable to us to now call it a pharmaceutical or drug. It's not necessarily easy to do, but it's a great thing that we're starting to do it because, especially in the realm of psychedelics, if we end up in a future where all we have for physicians and therapists to work with is a handful of single molecule psychedelics, and that's all that's covered by insurance, I think that's dangerous because it's very important that we don't talk in terms of better or worse or botanic versus synthetic, because they're both highly valuable. It's the keyword is different. They're going to be different. And those differences represent optionality, which I think patients and physicians alike deserve.
I like how we're talking about, in a sense, having a menu of options, and different people will prefer. And you can have one camp, I will only have raw mushrooms, natural, not even extracts. I just want to eat real mushrooms. Whereas a lot of people who are new to this, they're like, I really prefer tablets and capsules, please. And so, yeah, I think both of those exist. Would it be fair to say, guys, that science itself has evolved, that enables us to work with botanicals on that complex molecular level? Did that not exist, say, in the 50s, 60s, 70s? Is that a recent thing?
I think without synthetic science, and without modern laboratory advances, we wouldn't be able to run these molecules through a mass spec. We wouldn't have the tools to partner with nature in this way to merge that millions of year old laboratory with modern technology. I think we're really at the first time that we can partner with botanics in this new way.
Yeah, I totally agree. I mean, this is essentially understanding complex systems and our ability. I mean, you got to know what's even in the system just to even identify chemically everything that's going on, and then to examine, pharmacological interactions at any number of levels. It's a complexity, and it's certainly, I'll say we're certainly better suited now than we were decades ago in science to fully understand botanicals.
Yeah, so I mean, Matt's at the forefront of studying compounds like psilocybin. We're all big fans of that work, and in our conversations, we talk about it, and it's there's this question: why are we only studying synthetic? And there's this huge gap now because we're just at this time where we can start to deploy technology to standardize. There's this big gap. There's no real pharmaceutical grade GMP supply for botanic versions of various psychedelics. And, so I think that it's important to understand that the reason why clinical science has not been happening on the botanics and only on the synthetics is because the botanics aren't available to that standardized level, which is changing.
Thanks for making that point, Joel. And I was going to ask particularly around the psilocybin containing mushrooms. That's a lot of what we're talking about, and that is mostly in the media. We're talking about the full spectrum entourage effect. But are there other compounds, say DMT or iboga, that has a similar kind of complex botanical molecular structure?
Well, I'll say certainly it's usually the rule rather than the exception. If you talk about a plant that has, or a fungus that has, psychoactive effects, and I would say even broader, just medicinal effects of any type, that there's typically multiple compounds at play. Like I said, there are chemical relatives. So-called magic mushrooms. You have not only psilocybin, but psilocin and a variety of other related alkaloids, baeocystin or baeocystin. And we don't know any number of these, in addition to sort of the, sort of combination or full spectrum or whatever type of broader extract. You also have the potential for these other individual entities to have psychoactive effects. So I'd say, back to your questions, like in most of these cases, these plants you're going to have, each one of these is just a whole universe of discovery within it, like, different compounds, the interactions, even amongst the compounds that we've identified, but some of which we have no idea what biological activity they have. It's just, all of these, plants represent and fungi represent just huge playgrounds for discovery.
Yeah, I think a good example of that kind of discovery is what we've seen happen from the cannabis and hemp industry. A decade ago, that molecule CBD wasn't highly known, and I would have given anything to have had access to this lab and these folks and all this equipment, back then. But it's a very different world now, and I think that cannabis opened the doors for this type of research on psychedelics, certainly for DA Schedule I licenses and things, but we were all focused on THC, and then this novel discovery of CBD for lots of different disease states and reasons why people are using it. So that discovery is the right word. This is our first time to be able to look at some of these substances, especially the prohibited ones, through the lens of QTOF mass specs and HPLCs. And so what molecules are there that we maybe don't even know about across those 185, 200 psilocybin containing mushroom strains. It's what we're going to find out this next 10 years by looking into, what nature gave us in psychedelics. There's going to be some really unique discoveries over this next few years.
Yeah, you're both using really great terminology. This kind of universal playground and the complexity of the molecules is going to take, at least a decade to get there. And it reminds me of what Stan Groff was saying, that psychedelics are for consciousness, what, the microscope is for the cell, or the telescope for, the galaxy. And Matt, you've spoken about consciousness, and you were on our Psychedelics Today podcast before, and you had a great attempt at trying to explain what is consciousness. So could we talk about this question about, the synthetic, botanical, around this magic in magic mushrooms? What is it that, where is that magic piece in the molecule that somehow does something to consciousness that has these potentially incredible outcomes?
Well, we are at the edge when we start talking about consciousness, so I have to put that out there, that we're all out of our element in terms of drawing on solid expertise, because it's truly, at the edge. I mean, we certainly know broadly that going across these different psychedelics, that it's activation of the subtype of serotonin receptor, the serotonin 2A receptor, that psilocybin activates and similar compounds activate, that leads to this kind of dramatic change in brain function. And there's a lot going on. There's downstream effects on other neurotransmitters. There's activation, deactivation of brain areas. I think probably the most relevant level of analysis is really what we see in terms of the integration across the brain. You see a massive increase in communication across the brain, and in some cases a decrease in communication with more local networks, but at the trade-off being more communication across the whole system. It's like, normally in your neighbor, you talk more to your next door neighbors than you do people that live across town, but things are sort of scrambled up, and now you're having, it's like they've been, the internet has been installed, and all of a sudden you're having this communication with people across the city and across the world at the expense of maybe less talk with your neighbors. So this kind of massive change in communication happens. We don't know ultimately. I mean, when you talk about consciousness, like what does that, but the massive change in subjective experience certainly seems very tied to this cascade of changes that are prompted by the 2A molecule, and I think probably have something to do more quintessentially with this change in communication, the integration of activity across the nervous system. But when we get into what is actually fueling phenomenal consciousness, I mean, that's the hard problem, so-called, and we're all in speculative land there in terms of what that ultimate translation is, and how we end up with a thinking and feeling, like an experience that we all presumably have, like, something behind this experience that's still this marvelous mystery. And actually, I think we should be humble, and we might be up against limitations of our ability to understand the universe, with things like so-called hard problem, that the apparently difficulty in understanding what consciousness truly is. But gosh, we should use psychedelics and all the tools at our disposal to try to figure it out. I mean, it's at least fun.
Agreed. As long as we're open-minded and willing to observe, and willing for the possibility of things that we can't yet observe to be there, then I think we can get a long ways here with psychedelic research. And, we can't just describe it down to the molecules, these 5-HT2A receptors and all of the serotonergic compounds that influence our consciousness and our conscious experience. It isn't just that, necessarily that something's happening with the chemistry. What can happen is you can have a thought or you can have an experience that will then dictate the chemistry. Or we can add these psychedelic compounds, which will dictate a change in the experience. And so it really goes both ways. And, this, where I sit is a company called AJNA, and we chose that name because it represents the third eye chakra. And, it's a very ancient name, and it represents a doorway through which we access that subconscious mind, through which our therapist may access our subconscious mind. And it's really that doorway by which I think psychedelics and practices like meditation work. And so I think it's a two-way street between the chemistry in our body and the experience that we're having in the psyche.
Yeah, thank you. And we are on the edge of exploring this. And I think there's something beautiful about the role psychedelics are playing in kind of being the pioneer in the whole field of science around understanding, plants and their molecular structure and their healing potential. I wanted to see what you both think around regulation and policy and healthcare systems in America, Canada, Europe. So are they going to recognize botanical medicine and reimburse for it? And how's the clinical trial process going to need to change? And is there a role for real world evidence within that?
I think we have, because we have a huge disconnect between what thousands of people are using, millions of people have used, millions more people will use, especially in adult use states, as states legalize, different countries legalize. People are going to use, in the case of psilocybin, they're going to use the mushrooms themselves, particularly psilocybe cubensis, but a few other varieties. And I think it would be a shame if the medical system doesn't look at what millions of people are using. If it turns a blind eye and says, no, we can really understand what one molecule is doing at a time, so this is all we're going to accept. That would be a shame. I think that it's a public safety thing. I think that it's a public service thing to make sure that the representation of real world use moves into clinical science and becomes available on the other side. Availability to the botanic versions, in that they're going to be different. I'm not going to say better or worse, but going to be different. Availability to botanic psychedelics, natural psychedelics, shouldn't cease from the moment someone goes from an adult use recreational program to see their doctor, who can really help them with that psychedelic assisted therapy.
And it does seem odd that, in a sense, it seems like we're starting from scratch around trying to gather the data on botanical, raw form mushrooms, and yet they've been used for thousands of years. And there's
Well, I think that's changing. I think, Matt, would you say that you're in favor of deploying some standardized botanical psychedelics so that we can, for the first time, start to understand what their differences are and how they might be able to help us? What do you think?
Absolutely. I think research is the key to all of this. We need more information. And the point that's been brought up about, hey, it's not all in service of FDA approval of medicines. That's a really important area. And there's going to be tons of activity there in this area, but it's also understanding what people are doing. And sort of the medical model is just once in the largest context in terms of the number of people using these compounds. Whatever one thinks about it, it is a very, it's the minority. And so we have to understand this, and science should be brought to bear to, understand it all, to minimize harms wherever possible, and to the degree people, are safely getting benefit to maximize that.
Without wanting to put you on the spot, Matt, the trial that you're going to be doing around psilocybin for smoking cessation, do you know yet which kind of mushroom variety species you're going to be using, and whether that's going to be botanical or synthetic? Because that's a huge, really kind of epoch-forming piece of research that you're doing there. No pressure, but I think it's just massive what you're doing. It's great. What are your thoughts?
Yeah, still, I don't want to commit. Well, I'll say that the certainly the NIDA-funded research is going to be using a single entity, a psilocybin product. But then this line of research going forward, don't want to yeah, I could see going any number of directions.
Yeah, but this is the point, is that, you know, within the DEA Schedule 1 supply chain here in the US, you really don't have any pharmaceutical grade, what we call 211 GMP botanical versions that are really available in that supply chain. And so, you know, I think that hopefully we'll start to see a lot more studies that are deploying that real world use. But, you know, I won't speak for you, Matt, but, you know, but I think that probably you don't have the access within the regulatory mechanism if you want to study something different.
Yeah, and the history here is that, I mean, it's only, it's only really sort of in the present that a lot of these possibilities are opening up. And, it's been, I mean, gosh, 10, 15, 20 years ago doing this stuff, like you're lucky to get a hold of some psilocybin legally, from, some of the stuff that, Dave Nichols cooked up in the chemistry lab. And, so it really is, I mean, the availability has traditionally been a huge issue.
Not for long, Matt.
Yeah, it sounds like the future is
Yeah, it's
promising.
great.
Yeah. Speaking of the future, when we look at what's happening in Oregon and will happen by January the 1st, 2023, that's really on the edge of understanding psilocybin and humans' ability to use it with or without diagnoses, and particularly the fact that Oregon is saying they're not allowing synthesized psilocybin into that program. So it means the Comp 360, for example, that Compass Pathways is working on in their clinical trials isn't going to be used. It needs to be, a botanical formulation. So what does that mean potentially? What kind of statement is that making?
Oregon, we love Oregon. I wonder if that's more about protecting local economy and having the involvement of local economy and job creation. I think that Oregonians probably don't want to end up in that world where their only option is a synthetic from some big company. But I think that's going to be double-edged for them because the synthetics do provide value. I mean, if we picture a spectrum of light versus honing it in to create a laser, that laser is very valuable sometimes, whereas the spectrum just gives you a different value. And so I would encourage Oregon, if they were listening to this, I would encourage them to do what they can to include it all, because at the end of the day, I'm advocating for botanics because they're not in the supply chain. And for me, it's about optionality. So, we shouldn't either or this thing. This is both and.
Depending on how you do it, of course, the first challenge that comes to mind when you're moving to botanicals, it's not insurmountable, but is dose control. And so there are certainly ways to do this to characterize now, when you're talking about literally whole mushrooms, there's no, that is going to be a noisier thing because you can never guarantee until you pulverize them, homogenize, assay, and you could do all that. And then you can know this is the amount of psilocybin and psilocin in this sample per gram, but if you're talking about people eating whole mushrooms, there's always going to be some guesswork. It's always going to be like, you're eating 2 oranges. Here's our guess about the amount of vitamin C you're going to get, but no guarantees. So that is one of the big factors that contributes to likelihood of a difficult response. Apologies about that. So but again, not insurmountable. But these are questions that come up when one kind of navigates these different options.
Thank you, and perhaps just time quickly for a final question. I know we're not supposed to get into forward-looking statements, but if you were to think with your head what's going to happen around psychedelics' potential for healing mental health, but also biological medical conditions, and really feeling and hoping with your heart, say for the next 10 years or so, what would you say?
I'll say I certainly think, it probably no surprise, I think psychedelics are going to be a big part of mental health treatment. And I think it's a little more exploratory, that they're going to be a new direction in straight up, medical treatments outside of, mental health. So potentially strokes and neurological, conditions, this type of thing, given some of the different forms of plasticity we're seeing. But I think we've already seen enough at least in the psychiatric mental health realm to, I don't think it's wild speculation to say this is going to be a major new area of mental health treatment. Nothing's ever going to help everyone. Nothing's going to be the, magic bullet, but I do think it's going to help a lot of people that aren't being helped now. I think it's going to be big.
Yeah, I'll try and answer that quickly. I think that, and I appreciate your answer, Matt. That's, what I love about you is this angle that you're bringing about. It's so important because what I think your work does in the end is expands true access. And I know what it's like to live in a world where I've got a gray area product that's really helping people, but it's not, helping a lot of people because it doesn't have one thing, and that's physician advocacy. And in our world, we need clinical data to get physician advocacy. There's only a handful of us that are willing to go down to the jungle and sit in a yurt and drink ayahuasca and have a life-changing experience. And it can be a life-changing experience. These tools are not the answer, but they do open doorways for us to reconnect with who we are. And when that happens, we tend to lose some of these really old habits that aren't serving us if that's what we choose, how we choose to use them. And so there's only a small fraction of people that are using them right, getting this kind of healing, this epic healing. And it's not just for mental health. This makes healthy people healthier. But we're not going to see that hockey stick, the real momentum, the real world-changing power of the psychedelics until we have physician advocacy and until we have support from our doctors to go and use it. So Matt, thank you for your work, because I know it's going to mean a world for my kids in which that kind of healing is accessed by everyone. That's the future I'm seeing.
Well, that's an awesome way to end it. Thanks, Joel. And, we're zooming out from the molecule to kind of the social fabric of community and infrastructure, governments and policies. So yeah, that also has to have work as well as in the laboratory. So we could go on, guys, but our time is up. Real pleasure talking. Matthew Johnson, Joel Stanley, it's been a pleasure.
My pleasure.
Thanks so much.
Thank you both.